Congratulations on starting aligner treatment with us. My staff and I are super excited to be on this journey with you. The biggest thing to remember with any aligner treatment is you have to wear the aligners for 22 hours every single day. So pretty much what that means is the aligners are in your mouth all day long, mornings, afternoons, evenings, at nighttime when you're sleeping. The only exception should be when you're eating and when you're brushing and flossing. As far as drinks go, water is perfectly fine to drink with the aligners on. However, other drinks like coffee, sodas, teas, whatever you may be drinking, it depends on how you're drinking it. What I mean by that is if you're drinking in a short setting, 15-20 minutes, then my advice would be take your aligners off, have your drink. After you're done, rinse your mouth or brush your teeth and put your aligners back on. However, some people like to prolong the drink, meaning they take a sip, put it down, take a sip, put it down. If you're one of those people, then my suggestion would be keep your aligners on, because I do not want you to go too long without your aligners. So keep your aligners on, but drink with a straw. Now, if you're having a hot drink, please be careful. If the drink is too hot, you can burn the roof of your mouth or the palate of your mouth. So please make sure your drink is not too hot, but drink with a straw. And then when you're finished, some of the drink will still make its way into the aligners, so I would like for you to go to the restroom, take your aligners off, brush your teeth, clean the aligners, and then put the aligners back on. Now, it is very important that you're taking care of your aligners as we're going through the treatment. The biggest thing with that is making sure whenever you're not wearing your aligners, you always keep them in the case that we're providing to you. The aligners should always be in one of two places, face or case. Please remember that, face or case. Do not put them in tissues, do not put them in napkins. What we always find when patients do that is the aligners end up in the trash can. So please remember, face or case. Now, the other thing with aligners is dogs love these things. It's like a chew toy for dogs. So if the dogs get to them, they tend to chew them up pretty badly and they basically render them unusable. And sometimes even if the dogs get to the case, they will play around with the case, somehow get the case to open and chew up the aligners inside. So whenever you're keeping them in the case, please keep the case away from the dogs. So in cabinets, drawers, bathroom, wherever the dogs may or may not get to. So you're going to be wearing each set of aligners for either 1 week or 2 weeks. Every patient is different, so I will let you know how often to change them. It is important to keep track of that. The easiest way to do it nowadays is on smartphones. Just set yourself an alert that goes off when it's time to change. Now, having said that, please keep in mind that you want to wear it for that duration in a proper manner, meaning the 22 hours a day. Naturally, life happens, things come up. For example, you might get an ST sinus bug, or your best friend is getting married, and you're just, for those days, unable to wear the aligners 22 hours a day. If that happens, number one, please make sure you're at least wearing the aligners at nighttime so that we're not losing progress. Otherwise, your teeth actually start shifting backwards. We do not want that. So at least wear them at nighttime. But for every day that you weren't quite able to do it as much as you should have, add on a day to the end of that aligner. So when that notification goes off on your phone, think back, how did I do with that aligner? I did good, I'm ready to move on to the next one. Great, please move on to the next one. But if you had a day or two where you weren't so great, then adjust your schedule accordingly, and then just make sure you adjust your future notifications as well. Now, for the first 3 days of every aligner, you're going to be using these things that we already discussed with you called chewies. So just make sure you're using that every time you take the aligners off and put them back on, that you're using these chewies. There's 2 in the pack. They are reusable, just simply rinse and reuse. And these 2 honestly should last you during your entire treatment. However, if you happen to misplace them and you're coming in for an appointment, you can always ask us for more. Or if it's between appointments, Amazon sells them as well, so you can get them online as well. Now let's quickly talk about what to expect with these aligners the first few days. The attachments that you have on your teeth, the little bumps that we put on, and those will take a little getting used to. So in the beginning, they might be irritating your lips or your cheeks a little bit, but I promise you that will go away after a day or two. As your aligners start slowly moving your teeth, you will experience some soreness and some achiness. That is expected, especially for the first aligner. Usually the subsequent aligners, it doesn't happen as much, but you do feel it more with the first aligner. And as needed, you can take over-the-counter medication. Try Tylenol first. If Tylenol is not working, try Advil or Motrin. Please just make sure you're not allergic to any of those medications. And it's only on an as-needed basis. Some patients need it, some patients don't. So you can determine how you're feeling and take that that as needed. Also, what will help in the beginning are soft foods. So if your teeth are sore, soups, smoothies, milkshakes, pastas, rice, mashed potatoes, oatmeal, purees, those types of soft food items help deal with the soreness as well. We're also going to be giving you some written instructions that will go over some other helpful tips that will help you deal with the soreness in the beginning and how to take care of your aligners as well. One thing I would like to request for you to do is keep track of the bags that your aligner come in, and when you finish that aligner number, please put it back in the corresponding aligner bag, and keep track of that and keep them organized and hold on to them as we go through your aligner treatment. Sometimes we have to tweak your treatment plan and go to a certain aligner number in the past, and if you have kept them organized, it's easy to know which one to go back to. And once we finish your treatment, I will let you know what to do with the aligners that you have held on to, but please keep track of those as we're going through treatment. One last thing I wanted to discuss with you regarding treatment with aligners is oftentimes we need to do what are called the refinements. Think of these as touch-ups. What that means is if you have noticed on your bag there's a final aligner number on there. A lot of patients think that as soon as we hit that final number, your treatment is going to be completed. In most cases, that is not the case. All that's doing is that initial treatment wave of what the computer is predicting where your teeth are going to be. But please keep in mind that our teeth don't always respond to what a computer is predicting. So oftentimes we get to that final number and then we need to do another scan, or again for a refinement, where we take another scan, send it back to the manufacturer, and they send us a few more aligners to get us finished. Sometimes we need to do multiple refinements during your orthodontic treatment. In some patients, however, we do get lucky and we do not need to do refinements, and that initial set of aligners that we have will get us to the finish line. Congratulations again on starting your aligner treatment with us. My staff and I are super excited for you and are looking forward to getting you the smile of your dreams.